Good. Tell me, are we just talking people out of pain?
No, we're not at all. In my view, we're not at all doing that.
You hear that? You hear that rebuttal, or that I'm sure you've heard, or you've been in groups discussing, and maybe there might be some pushback to this idea, and say, are you suggesting that we're just trying to talk people out of hurting?
Yeah. Yeah. No, there's definitely some haters, and haters are going to hate, right? And I sort of get it. There's in a way. I mean, explained pain's actually not novel information, right? I mean, some of the core messages of explained pain were discovered in the 1960s, and the really powerful messages were discovered between the 1980s and, I mean, the latest edition, to 2010, but really 1980s, 1990s. There's nothing novel about the content. What's novel is us ruthlessly pursuing elevated understanding of that content for people who are challenged by pain. I mean, in a way, it's a no-brainer. It's a full-brainer, but it's how can we not be doing our very best to give people as accurate an understanding of their situation as we possibly can, based on the available evidence? I just think to me, it's incredible that any health professional in their right mind would think, no, we shouldn't be letting them in on that secret. So what I think is actually happening is that the reality of the human is really challenging to modern medical models of care, right? That are biomedically driven. We have entire professions that depend on modern pain science being wrong. And when I say modern, the last 50 years of pain science discoveries actually turning out to be wrong.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.